Hi everyone, how are you? Okay, we're back here again with Doctors Go Live on the Columbia Asia Facebook page. Today we're going to be talking about gout. Okay, this is quite common, we've all heard about it, but maybe there is not enough that we know about it. So we assume that eating a lot of meat can cause this painful bone disease, but what is the cause, how serious it is, and all that? Let's get an expert to address these questions. So today we have with us Dr. Kuan Woon, who is the consultant internal medicine physician and rheumatologist from Columbia Asia Hospital, Bukit, Rimau. Hello, Dr.
Hi, I'm fine. How are you also?
Fine, thank you. We're all good today. Okay, we'll just go straight to the first question, which is, what exactly is gout?
Okay, gout is quite straightforward. Basically, it's a form of joint pain or arthritis due to the uric acid crystal deposit around the joint and the tissue that lead to inflammation that cause arthritis or joint pain. So it's straightforward. It's gout. It's due to high uric acid crystal deposit in the joint, lead to inflammation of the joint. That's called gout.
Okay, so it's because of the uric acid. But what is this, like uric acid, and how does it cause gout?
Okay, uric acid basically it forms a crystal, deposit in the joint. Then our body reacts to the crystal that it causes inflammation. So inflammation causes pain, all these things,
Okay. So that is basically the cause of gout.
Yes.
Okay, all right. Maybe you can mention to us some of the risk factors or the profile of a gout patient, whether it happens more among female or male, and what is the age group, lifestyles.
Okay, so basically more common in male groups, okay, and usually found in those patients with high sugar, diabetic, or high cholesterol, overweight. Okay, then of course those got habit of drinking alcohol, then the risk of having high uric acid will be higher. Okay.
I see. Okay. All right. About age group, would it be something that happens more among youth, or is it something that happens in the elderly group?
Okay. So if that happens in a younger age group, usually it's probably due to genetic issue. I got patient as young as 18, 19, they also come with gout. Okay, but they are not overweight, they are quite slim. This kind of patient usually due to genetic factor. Usually those above 30, 40, most of the time is lifestyle issue and diet issue, So
gout is also hereditary, is it?
Sorry again?
Gout is also, if there is gout in the family, there's a chance that you also get gout.
Yes.
Oh, okay. 18 or 19, that's quite young actually.
Yeah, you see before.
So if as a teenager, if you get gout, you cannot play sports and whatnot because it affects your bones. Would you say that?
Okay, gout basically is intermittent. It happens, that means they attack the joint, cause the joint pain. But once everything resolved, then you're back to normal life. It won't affect, won't cause any damage to the bone or anything. But only if it's recurrent, then you don't treat it properly, it can lead to complication of gout.
It's not something that you live with, lah. It means you can manage the pain.
One pain over, then you're back to normal. But of course, some patients, they have it once in few months' time. In between the attack, they are quite fine. Okay.
Can you cure yourself from gout completely?
Sad to say that gout cannot be cured. If let's say there's indication, we give medication to prevent the attack. Okay. Because gout, there are a few stages. One is we call asymptomatic hyperuricemia. The patient comes with high uric acid, but they don't have gout. Then after that, certain patients, they develop gout attack. That means sudden onset of joint pain. So after that, they resolve. They become the third stage, we call intercritical gout. That means on and off, you will have attack. Some patients have a few months attack. Some patients, few weeks, depends on the genetic and situation. And then if you don't treat properly, you go into, we call the most serious type of gout, it's called tophaceous gout. That means all the crystal you can see around the knuckle, the elbow, the knee. That's the most serious type of gout. So when the patient reach that stage, they will have pain every day, so it's quite debilitating. You know, I got patient they can't go into this tophaceous gout account. So we should try to prevent patient from getting progression toward that health situation. You know.
You can see the crystals. You're saying that you can see the shape of the crystals, is it?
Yes,
Wow.
people growth, you know, in the tendon and the elbow, you know, it's tophaceous gout, like called chronic tophaceous gout. It's rare. It's rare to see, but we do see on and off. Actually, patients are
Yeah.
not. Mm,
Look like exactly like bumps
yes.
or cooked skin. Wow. Okay,
Photo
that
lah.
sounds very. Yeah, and it's very painful.
Yeah, very
I mean,
painful.
that's the question.
So,
what is the pain like?
of course, I never have got gout. How we feel like, but according to patient, the gout is more painful than having a kidney stone. For female, they say it's more painful than giving childbirth, delivery. So you can imagine how painful is gout. Okay, we wish that we don't have it.
Wow. Yeah, certainly we must watch our intake of uric acid lah. What advice can you give to someone who has gout? I mean, in terms of the kind of food that he or she should not eat.
Okay, once patient come with gout, so first we have to advise them on lifestyle and diet. Okay, lifestyle that means healthy lifestyle, lose weight, if those are overweight. So diet wise, we try to ask patient to try to avoid food which is high in purine, because purine when you consume in the body, it will turn into uric acid. So food that generally high in purine is like those seafood like the sotong, squid, the crab, then the prawns, okay, and then anchovy, ikan bilis, then ikan sardine, all is very high in purine acid. And then the other one is the red meat, the goose, you know, the beef, the steak, all this food, okay. And then the third one is internal organ, usually the liver, the kidney, the heart, you know, whatever. So
Yes.
last one, of course, alcohol. Alcohol is one of the main trigger factor for gout attack. Because when you consume alcohol, it can reduce the secretion of uric acid. So alcohol is one of the risk factor can cause gout attack.
Yeah, it's ironic that you should mention about the internal organs being very high in uric acid, because that's going to be quite a problem for Malaysians, I think, because they like to eat all the satay perut and then hati, limpa, and especially when you go to Padang restaurants, there's a lot of masak lemak with brains and lidah and all these things. But anyway, yeah, so that's the price you pay lah. Okay, so anyway, doctor, what are the symptoms of gout, or how would you know if you have gout?
Okay, the typical symptom of gout is first is onset. So most of patients they describe they are quite okay, they go to bed and first thing in the morning, okay, come they find a severe pain at the joint. Okay. Second, of course, the joint that involves typical joint that gout attack is the first big toe of our foot. Okay, then followed by the midfoot, that means then the ankle, the knee. Okay, so it's sudden acute onset that affect the joint at the leg. Okay, that's typical gout.
It only happens in the leg?
Okay, we don't know why, but 99.9% of gout initial onset affect the leg. Unless they getting worse, progressively become tophaceous, then they will affect the elbow, the wrist, but this one is at the terminal stage of gout. Normally it's affect the lower limb. If patient come with joint pain in the upper limb, then you have to consider other possibility other than gout.
Does it happen in one leg usually, or it can happen both legs simultaneously?
It's single
Both
joint.
legs. Single joint.
One joint.
Okay. Okay, we described the pain just now. And is it life-threatening in any way?
Okay, so gout won't kill you, and gout is not a life-threatening disease. But of course, if you don't treat it properly, it can lead to few complications. First, of course, high uric acid with recurrent gout, it can lead to kidney stone. Okay. Second, high uric acid or gout it can lead to kidney damage. One, maybe because of the crystal block up the tumor in the kidney. Second, most of the time the patient keep on consuming painkiller when they got gout attack. So this one can contribute to the kidney injury or kidney failure. Okay. The third one is, as I mentioned before, if having a recurrent gout, you don't treat it properly, it can lead to this formation of crystal outside the joint in the skin, all these things which can lead to chronic pain, and joint damage. Okay, so gout won't kill you, but it will make you suffer.
Yeah, of course, and all these complications that come after that. When should you see a doctor if you suspect that you have pain? Instead of just taking painkillers at home, but when would be a time to actually go out and seek professional help?
Because if you're having recurrent pain or the pain is really unbearable, I think you should go and see a doctor and check out. Make sure it's gout or it's not other disease that causes the chronic pain.
Yeah. So when you go and see a doctor, and what will the doctor do in order to diagnose you, in order to see whether you have gout or not? What are the tests that you have to go through?
It's based on history, like I mentioned, acute onset affecting the second, of course, if you examine you to make sure there's really a swelling joint or arthritis ongoing. Of course, the definite test we do is to do a blood test to check the uric acid. So if uric acid is high, combined with the typical history and examination, then we can confirm gout. But of course, in rare occasion, if you want to be 100%, then what we do is we stick a needle inside the joint, aspirate the fluid, put under microscope, look at the crystal, the uric acid crystal. That one is 100% confirmation. But most of the time, you don't do that because it's classical gout. Then you just treat as gout. We don't need to stick needle in the patient.
Yeah. So when you do a blood test, that blood test results can tell whether you have gout or not. Or not sure. Like you mentioned just now, that's not a fixed way to tell whether you have gout or not.
Now I to combine the blood test. If uric acid is high, combined with the history of acute attack affecting the single joint or rolling, then I will get 99.9% is gout already. Okay.
I see. Okay. So a normal blood test you should also take a cue from your blood test result. Okay, all right. And then following diagnosis, once you have diagnosed someone as having gout, what is the following step? What are the treatments that you have?
Treatment for gout, there are two sections. One is we treat for acute gout. Patient comes with acute severe pain, acute attack. Then the main aim of the treatment is to relieve the pain, help him recover faster. So in this group of patients, usually conventionally we give painkiller, all the NSAID painkiller to reduce inflammation. Then other drug we can use to treat the pain is colchicine. Colchicine is not the painkiller per se, but it will help in the pain in gout. Colchicine basically is safer than painkiller because it doesn't affect the heart, the kidney. So usually we use colchicine. But if the pain really unbearable, then we combine with the normal painkiller. And the last drug we can use to reduce the pain and inflammation is steroid. Usually we give steroid for those patients who can't take painkiller, like the renal failure, can't take colchicine, got allergic reaction, then the steroid will be very helpful. Okay. Second section is to prevent the recurrence of gout. If let's say the patient come with every week or every month they get having gout, then you give medication to reduce the uric acid. So normal uric acid range is around 400. So if we can reduce it below the upper limit, around 350, then the risk of recurrent gout can be minimized. So the drug we give is allopurinol. So in those patients with recurrent gout, or they got kidney stone, or they come with really severe gout with tophaceous gout, then we have to start allopurinol on top of the normal painkiller. Okay.
I see. So those are the things that you prescribe at the hospital. But once the patient goes home, what are the things that the patient can do in order to alleviate the pain? Some home remedies, perhaps.
Home remedy, of course, it's not proven scientifically. No study to back up. So, so they can put ice pack,
Yeah,
try to
yeah.
with the movement, by
Mm.
medication. The alternative wise, a lot of remedy like citrus, vitamin C, apple cider. It's not proven, not backed up by
Yeah,
scientific.
right. I see. I see. Okay.
So,
What about exercises? Is there any exercises that can help the pain?
no, when patient having attack,
Movement.
I think you better don't move the joint. You have to rest the joint because any single movement, patient is screaming in pain. So there's no exercise to help. But when they got inflammation, then the best is put ice pack. To reduce the inflammation, the swelling, this kind of thing. So usually the pain will last. Typical gout attack with medication, 1-2 days they should subside. Okay.
I see. So if you have gout, if you have been diagnosed with gout, does that mean that you live with gout forever, or is that something that can be cured completely after treatment and whatnot?
Okay. Sad to say that gout cannot be cured. So like
Oh,
diabetic patient
yeah.
will stick with you forever. But we don't know why certain patients with high uric acid got gout. So all depends on genetic and food intake, all these things. So for those patients who are high uric acid, then of course advisable to live a healthy lifestyle, weight reduction, stop alcohol, try to avoid all the high purine diet. When they got attack, then we treat. If they got more frequent attack, then we give the medication to prevent the gout attack to suppress the uric acid, which is alloprenol. But to totally cure is impossible, at this
Okay.
moment.
On average, like from the cases that you have seen, on average, how often does one get the attack? Like every few weeks or every few days?
Uh,
Generally, like.
there's no study or statistic
Hmm.
for me to tell how frequent. All depends on the
Okay.
lifestyle and
Okay.
the genetic.
Right. I see. Okay. I see. So how do you prevent gout?
So as I mentioned, to prevent gout, you have to live a healthy lifestyle and stop alcohol, stop all the delicious food, all this then organ, red meat, this kind of thing.
I
Okay.
see. Okay. So those are the food that you should avoid, lah. And are there any types of particular food that can lower uric acid in the body?
Okay. At this moment, I don't think so. Of course, those food
Okay.
you try to eat is vegetable, whole grain diet, help with it, but actually it's not like a lot of margin. All those are healthy food, so you should consume.
There's a lot of diseases, of course, like including gout, that all boils down on one's lifestyle.
Yes, correct.
Right? So generally, we just have to lead a healthy lifestyle with our food intake, exercises, and whatnot. Okay, if you have any questions, viewers, you can always type the questions in the comment section, and then Dr. Kuan will be able to answer those questions right now. So let's see whether we have any questions yet. It's okay, we don't have any. Perhaps if there are questions after the show, they can still type, and then we'll address the questions later, lah. Okay, doctor? We can do that. So thank you so much for your time. That was quite comprehensive, actually. And hope to see you again. Thank you, everyone. Bye.